Welcome to Alternative Family Medicine and Chiropractic. My name is Dr. Anne-Marie Barter. I'm the founder of Alternative Family Medicine and Chiropractic, and I'm also a treating doctor. We opened in 2010 in Longmont, Colorado. We still continue to have the Longmont location, but in 2013 we expanded to a Denver location. We specialize in a multitude of different modalities, from structure to nutrition to specialized testing. For our structural complaints, we focus on things like low back pain, headaches, upper back pain, neck pain, and anything going on with the extremities. Extremities are simply your hips, knees, toes, as well as your feet, and also your shoulders, elbows, and wrists. We address complaints in these areas using hands-on techniques. We use techniques like dry needling, shockwave, focus muscle work. We use a technique called Graston, which is scar tissue work, and we use cupping. We also use adjustments to treat that, both high and low force, to put the body back into alignment, decreasing pain and increasing mobility. We also use a lot of muscle treatment to treat the fascial adhesions and the scar tissue. Doing this unwinds the body. It helps the joints stay in position much better. This is something that makes us very different from other chiropractic offices. We have 30-minute follow-up appointments to really make sure we're focusing on those areas that need additional attention using a variety of modalities. We also have a nutritional portion of our practice that we think is very important to also help additional symptoms. We focus on natural remedies in our practice. We focus a lot on gut health, and we'll do anything from parasitic infections to bacterial overgrowth, focusing on conditions like SIBO, H. pylori infections, or imbalances of good bacteria. We're gonna also treat a variety of conditions like bloating, constipations, loose stools, floating stools, malabsorption syndromes, IBS, leaky gut, and food sensitivities. We're ideally going to reduce your food sensitivities so that you don't have as many, and the variety of foods in your diet can be so much better. We believe that it's ideal to have a well-rounded diet versus being able to only eat 5 foods per day. Diversity in the gut is key. So working on incorporating more foods is something that we think is really important in our practice. We also work with mold exposure, heavy metal exposure, mitochondrial imbalance, nutritional deficiencies, thyroid issues, hormonal imbalances like PMS, perimenopausal symptoms, or the menopausal transition in women. We understand that, so we're there to help you all the way through that process. Whether it's a week before your period, you just feel so crampy and incredibly irritable, or if it's because you can't sleep right before your cycle is starting, we can help you through that process. Or maybe when you're actually in the perimenopausal changes, your emotions can be all over the place, creating a lot more anxiety, depression, or the issue is you can't sleep, which is one of the biggest dysfunctions that we see during that time period. We have a deep passion to help women also with neurotransmitter imbalances, and men for that matter. These can be lower serotonin, lower dopamine, lower GABA, or lower acetylcholine. All day long, we hear about symptoms associated with lack of motivation. You feel depressed, but there's no reason to feel depressed, or maybe you just don't feel as happy as you should be, or maybe your memory is going, or maybe it's incredible anxiety. But we want to just build you back up to feel like you used to feel. So some of the common issues that come into our office generally tends to be a lot of gut related issues like bloating, constipation. We see a lot of low energy. We see pain. We see a lot of sleep disruption, like you can't fall asleep, or you wake up in the middle of the night and you're up for a couple hours on end. We also see hormonal imbalances like anxiety and depression. Actually, some people would just like to get a health check to see where things are, where they can improve their health, and how they can feel even better. People tend to spend a lot more money if we're just throwing supplements at the problem or not really getting to the bottom of, the symptoms. So we have a variety of specialized tests that we run on both adults and kids. That means that we're not going to run all of these specialized tests on every person. We create an individualized approach to your specific case, deciding what testing might be the most important. And we really want to start top down. We want to start at the area where we might have the most fallout to other symptoms, where we can address maybe at the tip of the pyramid, and then we'll get downstream effects from that. So we really feel like an individualized approach is the best way to start in practice to get to the bottom of the symptoms that maybe you're feeling. Certain people like to just start with one test. Certain people will just come in and bring in the blood work that has been run by their primary care. Other people want to run 3 or 4 tests just to see. So everyone's a little bit different, and it really depends on how many symptoms you have and how quickly you want to get to the bottom of everything. Functional testing that we recommend or work with, we have a variety of tests that we use. So we use the GI map. We'll use SIBO testing, breath testing specifically. We'll use an organic acids test. You will use food sensitivity testing, Dutch testing, which is a hormone test. We'll use blood chemistry, just a regular blood draw. We'll do mold, heavy metal, and micronutrient testing. When we get the results of those tests, we use diet changes, lifestyle changes, and supplements to address the symptoms basically the lab values that we're finding and the symptoms that you have. We always get asked what happens in a first appointment. We generally are gonna go through your health history. We're gonna see when these problems started, what could happen around that. We're gonna go through failed treatments that you've done in the past. We'll go through some of the lab testing that you've had previously, and then we'll create a protocol of maybe what testing. The conditions that we work with are going to be IBS, it can be constipation, diarrhea, or a combo of that, SIBO, parasitic, mold, heavy metals, thyroid issues, hormone imbalances, and musculoskeletal injuries. You're gonna get paperwork. You can submit any testing that you want us to look at. After the initial appointment, you'll get your lab testing back. We'll do a lab review, and then for scheduling, you have a couple options. We have a Longmont location, we have a Denver location, and you can also be seen virtually. I think if you want more information about what we do in practice, it's on our website called drannmariebarter.com. And you can hear talks where we talk about neurotransmitters, mold, gut health, and it's both of me being interviewed and interviewing people. So you can get a lot more information about maybe our approach if you're interested in that. And then just reach out to us if you have any more questions. We look forward to hearing from you. Thanks, take care, bye-bye.